Diabetes Canada wants to end diabetes. That means to prevent diabetes where possible, and for those people who have diabetes, to end the impact that it has on their lives. Diabetes is a disease that's well known, but not known well. It impacts 30% of strokes and 40% of heart attacks. So that means that the impact of diabetes on these very common conditions is quite large.
Patients who have well-controlled diabetes don't get these complications. We're using all the new medications and devices that are available. Unfortunately, they're expensive, and 1/3 of my patients have extended medical coverage. That's great for them, but ultimately I have to assume in at least half my patients that they're paying out of pocket for what I'm prescribing. I'm restricted in the patients to whom I can reliably prescribe based on economics.
So a patient and a physician can decide that a particular medicine is most appropriate to manage their condition, but that medicine may not be covered by a person's publicly funded drug plan. In those cases, a patient has a choice. They can not fill the prescription because they can't afford it, or they could pay out of pocket.
Mark is a single man in his 70s on an old age pension, living in the cheapest rental property he can find, and he has heart disease. He's had heart attacks. He's the very patient who needs a drug from the SGLT2 inhibitor class, who can sorely afford the $3 a day to take this drug. The last time I saw him, he's paying out of pocket. He's not the only person like that in my practice.
Well, I'm paying it out of my cash flow. That was part of the problem. The medication itself would cost me normally about $103 a month. And I'm low income. So that's a big number for me because you don't have that kind of cash. So
the research that takes place across the world is performed in order for patients to see better health outcomes, live longer and live better. But if they can't take the medicine, then those benefits are not achieved. 1/4 of patients aren't able to take their medicines as prescribed because of cost. And many patients have to choose between rent, food, and utilities, and filling their prescription.
In many cases, these drugs are unaffordable. So the duty of the province is very clear in my mind.
The drug access system isn't working. There must be ways to ensure that the individual gets the right drug at the right time.